And we are happy to welcome Sean Smith and his team here from Symba Center for this community information session. Sean, I think I will kick it over to you now to get started. I will stop sharing and allow you to share.
Thank you, Ayana and the Maternal Health Network team. Before I get started, I just want to make sure you all can see my screen.
Yep, we see it.
Wonderful. Just get set up here. At any point, if there's any questions during the presentation, please feel free to pop them in the chat. We'll be happy to take any questions you guys have while we talk. And some of the questions we may get to at the end as well. But please, any questions you guys have, pop them in the chat. We reserved some time for a little bit of a Q&A. So there'll be time to ask questions as well if you don't want to write them down in the chat. I'm happy to be here with you all today. My name is Sean Smith. I'm the CEO of Symba, and I have a couple other team members with me today who are going to be presenting. We have Shelby Martinez, who is our registered nurse and clinical coordinator. We also have Ashley Martinez, who is our program manager. And we also have Nettie Jackson, who is our special projects advisor. Each person that will be presenting provides an integral service for recuperative care for those in need. And, we're really excited to really share specifically how we can serve pregnant and postpartum mothers and their children during the presentation today. For the first few slides, I'm going to give kind of an overview of Symba, and then we'll dive into how you can partner with us to refer patients to us and get an understanding of what type of services we offer. So our organization at Symba is a nonprofit organization. We are faith-based. We provide intensive wraparound services to the low income, the homeless, and the uninsured throughout San Bernardino County. We are based in Victorville, but we also provide services in Fontana as well as Ontario. And these services are based in medical services and background. So as you can see, my background is in medical. We have therapists and behavioral health professionals. We also provide housing navigation, just a brief overview of who we are and what we do. Our core values at Symba are represented here. Our first being service. We also want to yoke with the community. I know that's a bit of an archaic farming term, but we believe in bearing the burdens together. And if we do that together, then the community will be better. We also want to make a difference, which is a little bit about what we're going to talk about today. We want to be able to measurably meet the need of our community. We also want to do the right thing when it's inconvenient, and we want to advocate and be a voice for those that don't have one and give them a voice. So that's a little bit about Symba. Also, we have a pretty large footprint, as I mentioned. We operate in the city of Fontana, in the city of Ontario, and in Victorville. All three of these projects are really kind of shelter-based projects where we actually provide beds for people who are chronically homeless. And then Victor Valley College, we provide services to their students. We operate a student health center there. We provide mental health services to students on campus. And then we also provide housing navigation services to people and students there who are aging out of the foster system or are couch surfing or living with a friend or living in their car. We try to make sure that they have stable housing while they're in school. For the purposes of this presentation today, we're going to be focusing on our City of Victorville Wellness Center campus, where we have the most robust services and where we partner with the city to provide a comprehensive clinical care model of recuperative care. And so with that, I'm going to pass it along to Nettie Jackson, who's going to provide some of the history of the City of Victorville's Wellness Center and what type of services we're providing on this campus.
Good afternoon, everyone. My name is Nettie. Wow, the Victorville Wellness Center. Just to give you a little background on how the city of Victorville came about in wanting to develop a wellness center. Um, uh, Back in 2021, the city, after they did their point in time count, started realizing that they were dealing with a high number of unsheltered individuals in their community. It was the first time that they came in under the county of San Bernardino as the number two city with the highest numbers of unsheltered individuals. From there, the city's also taking in recognition that their community, their constituents were having concerns about the high number and ever rising number of unsheltered individuals. And listening to their community, they've taken a poll and wanted to know what their constituents wanted from them, and as far as services, as far as things that they would like to see happen in the city of Victorville. And the number one issue that came to forefront overwhelmingly was they wanted the city to do something about the unsheltered individuals in the community. So with that, the city actually came up with developing a homeless solutions task force, which Dr. Sean was part of that task force. And the task force was made up of various community members from business sectors, medical sectors, um, faith-based and other nonprofit sectors that was part of our community and wanted to support our community in addressing the unsheltered population. With that, the city hired their first homeless solutions coordinator to support them in understanding how to tackle the issue that they had at the forefront, because the city, as we most know, they deal with other issues other than directly dealing with providing direct services to people. And when I say direct services, social service model. The city is not like that. They can provide water services and gas services and stuff like that to you. But as far as social services, they had no experience within that arena. So they hired their first housing solutions coordinator who supported them in understanding the need and how to take care of the need. And with that, the city came up with the ideal of creating a wellness center. The city went after the Home Key grant that is initiated by our governor here in addressing homelessness. They were actually awarded the first Home Key grant, but it was only for $1.7 million. And the city knew that that would not be sufficient enough to tackle the issue that they were dealing with at hand. So they did not take that money. Moving fast forward to 2022, their numbers got higher. They and they knew they had to do something very quickly. So the city applied again for the Home Key grant, asking for more funding, and they were awarded $28 million because the state saying that they were the number two city in San Bernardino. So with their $28 million, this is how they came about with building this wellness center. The wellness center is what constructed with recycled materials. So what you're looking at is what we call pods, and we went to the city of Victorville, made a contract with a construction provider who was able to use material, sustainable recycled material, to construct these units. Some of the units, as you can see, you can't see it that well, but the bathrooms were made out of like storage containers and stuff like that. Very creative, sustainable material. They wanted to use something that would not cost as much, but it did end up costing quite a bit because of the infrastructure had to be laid out for the wellness center. With that, they knew they needed to tackle the problem. They couldn't tackle everything, but they knew that they can make a dent. So the wellness center is 170 beds. Um, there are 7 units that support our unsheltered individuals. 5 of those units being for individuals and or couples. One unit is for our recuperative care model that we have on campus, and the last unit is our family unit. We only have one family unit, and it holds up to 7 families. That family can be made up of no more than 5 people going into those units. So with that, 170 bed with 110 doors are able to accommodate the folks that we bring in. The Wellness Center currently stays at 98% capacity because of the sheer numbers that we have in our community. The last point in time count that we had before the Wellness Center opened was 644 unsheltered individuals in our community. Since the Wellness Center has been open, Symba Center, along with the city of Victorville, has reduced the number of unsheltered individuals and families in the city of Victorville, helping to reduce the numbers also in our county. We were able to reduce those numbers by 57%. So when I say unsheltered, meaning we don't have people on the streets. And this model is showing that it works. So we do consider this the flagship model in the county of San Bernardino, where we, as Symba Center, have supported other cities, Fontana, and currently the city of Ontario, in looking at this same type of model and helping to reduce unsheltered in their communities. Lastly, I want to say what we have at the Wellness Center that is very supportive. What we wanted to do was have a one-stop shop. So we have a medical clinic that has been recently certified for a Symba Center. So they are able to provide multidimensional wellness services that is inclusive of recuperative care, primary care, to support any and all individuals coming onto our site. We have a full functioning professional cafeteria where individuals can come in and eat nutritious meals that are made by our kitchen staff and chef. And lastly, we are able to provide case management services and peer supportive services who their goal is to really work with our clients in creating wellness plans that will support the clients or the guests or participants that we call them in transitioning into a permanent housing solution. So with that, the Wellness Center concept is really about having an integrative model that shows that primary care and recuperative care can be done in a low barrier shelter site. This diagram is to help understand how when we bring services in together, they all come together, funneling to the client and ensuring that all services are met in a dignified manner, and that clients can finally feel like that they not only are they being helped, but help for on whole health. So when I say whole health, I'm looking at mentally, physically, emotionally, and lastly, spiritually. So with that, before I end, the people who help bring all of this concept together is case managers, peer support specialists, community health workers, pharmacists, nurses, medical assistants, and lastly, all of our administrative staff that support this model and making the client feel like they can finally have an easy and graceful way of living.
Thank you, Nettie. Appreciate the overview of the Victorville Wellness Center. And now I want to talk a little bit about what recuperative care is. I know we've been talking about the term or the phrase, and it's probably something that's unfamiliar to some. And so I wanted to make sure I describe very specifically what recuperative care is. So recuperative care is a place for people to go who are experiencing homelessness and they're just leaving an acute care service. So that means they could have been hospitalized, they could have been in a skilled nursing facility, or they could be in an acute psychiatric facility. And if they get discharged from that facility and have no place to call home, right? Recuperative care facilities are facilities where people can get discharged to ensure that they recover safely and avoid having to do so on the street. Okay. And so these are places that are safe to recover. There's clinical oversight. As Nettie mentioned, we have a full clinical team that provides support. There's care coordination and case management so that people can get access to their documents that they need to apply for jobs, to be able to get access to their Social Security benefits, and also provide them with a housing plan. And so while they're at the facility, the average length of stay at the Wellness Center for recuperative care patients is about anywhere from 60 to 90 days. But the Wellness Center itself has capacity to basically house people for up to 6 months. And so we focus on stabilization and give them a place where they can rest. I think a lot of people end up in difficult situations because they're on the street, they're ill, they need their insulin, they need their blood pressure medicine, they need wound care. And that's what service we're providing for people who would otherwise be on the street trying to recover. And then it's time limited, right? So it's not forever. It's not for 3 years or 5 years. It's more short term. It allows people to get back on their feet physically so that they can work on themselves to be able to work towards independence. And so that's what recuperative care is. And just a little bit about the model that we provide there. We have a certification from the National Institute for Medical Respite Care, and this certification was completed recently due to the hard work of our team, meeting certain fidelity standards that are national benchmarks for providing this service. And the list that you see here is kind of, builds up the team and the model that we have. Nettie mentioned a few of these items. I'll say that number 5 is really important, which is medication management. For all the people in recuperative care, we help them take their medicine. We help them take their medicine on time. We make sure that they're on schedule, and we make sure that any medications that the patient is discharged with, in addition to any ones that they were taking before discharge, are reconciled by a pharmacist, someone who's actually, has a degree in managing medications, as well as other nursing staff to ensure that we are giving the patients the best opportunity to maintain their health. This requires, also behavioral health. So we have therapists on site and 24-hour programming. So if a patient is in the middle of the night having a chest pain or some other symptom that may be severe, they will go to our, we have our staff on site, and if the staff on site are not clinically available or able to provide that higher level of care, then we have on-call support so that the staff there can actually call someone with an advanced degree in medicine who can be able to support the patient through whatever they're going through at the time. And so we do have a lot of team members that we work with. We have pharmacists and nurse practitioners, case managers, behavioral and occupational therapists. Occupational therapists are a big component of our program, substance use disorder counselors, LVNs. And so everything that we really focus on at Symba is trying to provide interdisciplinary care because we believe that every different specialty has its expertise. And in order to best serve the patient, everyone's voice and expertise is needed in the various trainings that they have. Just wanted to kind of highlight this slide here, just represents, how we make this happen. So the recuperative care especially are contracts that we have with IEHP. IEHP offers contracts to providers. And so the way we make this program work is we bill insurance. So the patients that come in with Medi-Cal, if they need primary care or behavioral health, or if they need enhanced care management or recuperative care or housing navigation, those are services that we can bill for to be able to hire the staff to provide the services. So what we're looking at here is like a public-private partnership between the city and Symba, where the city provides the facility and helps pay for some of the staff, and then Symba does the same by billing insurance so that we can build a really comprehensive model to surround the patients and the participants that we work with. So now I'm going to move over to Nettie again, and Nettie's going to kind of describe the pillars of service. And really, these are domains that we live by to ensure high quality care at the Wellness Center.
So first, what we have here is housing first. Housing first is a principle that we follow. It is an evidence-based principle when working with unsheltered individuals. The goal is that we want to house them, and whether that be interim housing, what we call at the shelter, transitional housing, or even into permanent housing, which is the ultimate goal. Housing first means that we're going to try and put you in housing despite the challenges and barriers that you're going through. Um, Me as a person who's been working in this field for a very, very long time, I've seen where people were denied housing because they were still struggling with substance use, because they didn't have access to an ID or a birth certificate. We no longer practice that. Our goal is to get you off the streets and into housing because evidence shows that you start getting well when you're underneath a roof. Our next pillar of service is low barrier, meaning that we are going to provide you services immediately. Again, being in the field for a long time, services used to be was if you didn't have an ID, you couldn't come into the shelter. If you didn't have an ID, we couldn't provide you services because we didn't know who you are. So you stayed out there struggling. Low barrier means we're going to bring you in. If you're able to pass a simple background test, regardless whatever you have on your record, as long as it's not what we call a 290 sex offense, or open felony, meaning somebody's looking for you right now that you need to appear in court, we will bring you in. We have several people that we bring in, well, mostly all of our people we bring in with no IDs, no birth certificates or anything. Our goal is to help you with that. If you're struggling with substance use and or alcohol or your mental health is unstable, we're still going to bring you in because our goal is to help stabilize you and give you the resources that you need. So with that, we practice a trauma-informed, person-centered approach. Our goal is to provide services with dignity and inclusion, and we want to hear your voice. You're going to tell us as a participant of our programs, what do you need? What really matters to you? And how can we support you in creating a wellness plan to where you will find success? So with that, our goal is to always keep our staff trained. We on various modalities that is supported in this field. One of them being motivational interviewing, allowing the client to use their voice and really get us to understand how we support them. And motivational interviewing is a technique that has been used for many years in the substance use and behavioral health arena. We use cognitive behavioral therapy, dialectical behavioral therapy, seeking safety. We use these tools in conjunction with our recuperative care model and medical care model in supporting the client and moving forward. So all of the models that I just said are evidence-based. They support us in keeping good data because without good data, we can't tell what we need to do and how we need to move forward or how to even make changes. So we work with our data coordinator and our data team in ensuring that we're collecting appropriate data so that we know as a agency and an organization how to move forward and or to make changes as needed. Our data supports our community. That means you guys. We are all in this together as collaborative individuals and wanting to support our community. The overall goal is to create a healthy community. And so with all of this information, we want to remain transparent and most importantly, collaborative. We participate right now in the County of San Bernardino's continuum of care, and so we are there providing information on our results and even our challenges that we have, because we want to keep the our community informed, and we want our community to know that we are here for them.
Thank you, Nettie. Yeah,
You're
thank you very
welcome.
much for that. We also are about to now transition into really a little bit more specific about what's the experience of the services that we're going to provide, especially for the patient population we're discussing, which is pregnant and postpartum mothers. So with that, I'll pass it along to Shelby, who will be presenting the next couple slides.
Hi, everyone. So I wanted to start off by talking about the clinical excellence that we have at the Wellness Center by just having our medical staff 24 hours on site. But ultimately, when the patient does arrive, it's number one, determining either how far along they are or how many months postpartum they are, because those two things are crucial and how we make the care plan for the patient. So they will meet with our family nurse practitioner. We do have one on site, or we do have a doctor as well, and kind of just determining their past medical history, if they're on any medications, if they're currently seeing an OB, if they need to get connected with an OB, if they have insurance. So kind of really just getting down to the nitty gritty and just starting from the bottom. And this all begins at intake. Something that I also wanted to highlight was the transportation that we're able to assist with recuperative care and either the pregnant mothers or the postpartum mothers. We do have a lot, we're very thankful with a lot of donations with either like newborn clothing, supplies, some, bassinets, cribs, also car seats and strollers, which is really helpful for the mother and even the father. Sometimes we do have pairs on site as well. Something that I really wanted to highlight, a lot of the time, say if it is a first time mother, we do like to provide them with that extra care by having the 24/7 medical staff on site. And that is just an open door policy. They're able to come to us any time of the day. We have medical there so that they are able to ask us questions, asking us, hey, is this amount of bleeding normal for 2 weeks after postpartum? Or, hey, I'm experiencing this symptom before and I'm 24 weeks pregnant. Is this normal? We're able to give them that educated advice at the time and say if it is overnight, then we want to try to connect them with the proper resources during the day, whether that's seeing their OB, whether that is going to the emergency room. We will definitely go ahead and point them in the right direction and also provide them with the transportation. A lot of our either pregnant mothers or postpartum mothers, we know how big mental health is, and we want to really highlight the fact that we do have professionals on site to assist with our patients. Like we have our licensed marriage family therapist on site, and she is more than willing to talk to our patients anytime that she is available. And especially if a patient is struggling, we want to ensure that we are assisting with the patients in those critical times and really making sure that they are heard. We also do partner with local doulas, and also we've been establishing connections with our home health providers in case we do have mothers or even children who need home health. We do allow those services to come on site so that it's no different than as if they were in their own home. We want to have a sense of normalcy here and really just promote that when we do have the patients here at the Wellness Center. During their time that they are with us, we do have our case managers and our housing navigators who actively work with the patient to try to find permanent, stable housing for the mother and the child. And that's like Nettie was saying, they could have no vital documents. And so we're starting at ground zero. And so the timeline on how long it could take for them to get housed really is based off of where the patient is at in their housing journey. I wanted to go over a little bit about what the specific room looks like as far as when we do have a mother and a newborn, or even when we have a pregnant female who will eventually move into that private living quarters. So that's why it's so important that we do know how many weeks pregnant the mother is so that we could start planning effectively and ensuring that hopefully by the time that they do give birth, that they could just transition right into a family unit. So what this looks like, it looks like it's similar to our recuperative care units, where it has the bed, it has an in-suite shower and restroom, so the mother does not have to use the communal shower and restroom. There's privacy. The mother is not sharing with other family members or other women in her situation, so they get that sense of privacy. And then also, we do have a lot of good support there on staff as well. We have our wellness checks that will go check on the mother. Obviously, we do pay attention to there is a newborn. We don't want to disrupt the child's sleep and also disrupt the mother, but also just letting them know that we are here and that we're able to support them. So, with that care, that's really the wraparound services that we are providing with the mental health, having home health or doula come on site, and then also connecting the mother once they do have the child to the pediatrician and ensuring that they're meeting their appointments. I'll go ahead and talk about also the patient's experience, what it's like living at the wellness center, being a mother. So, for example, safety is our number one priority. We do have 24-hour security presence on site, and the way that we communicate is via walkie-talkie. So it's quick communication, and we try to ensure that if we have a patient who is suffering from domestic violence, we want to ensure that we're not letting anyone know that that patient is here. So the patient's information is protected at all times, and that starts at security. So no one is let into the facility, wandering around the facility, asking questions. It is like a locked facility, which is beneficial for mothers because security is a number one priority. The mothers also do have, or families have dedicated meal times. So, what this does, it provides that calmer, more comfortable dining experience while also allowing them to really bond with others who are going through the same thing or other families within the same unit. This also is a smaller, they're in the cafeteria, but it's a smaller setting. So, it's more intimate as far as they're able to really enjoy their time while eating the meals. And then something else that I wanted to highlight as well is the family engagement and connection. So we do hold multiple meetings and classes. So that could be either a family movie night. We try to do crafts for the children. We do have parenting classes on site that our staff hold. And then also, we just because they are living at the wellness center for that short period of time or in the recuperative care program, it does not mean that we don't do certain holiday themed activities. We do focus a lot on listening to the patient's voice as far as if it's summertime and they want to do a water gun fight, or there's different things that they request. We want to ensure that we hear them and really ensure that they feel comfortable being at the wellness center. So the most recent event that we did have was Easter. So what we did was we held a egg painting event for all the children on Easter. And although if a mother just had a newborn, it is something that they could take part of and really be present during that time so that they could eventually have traditions of their own. So this provides the families with a sense of normalcy. What this means for the patient. So this is a sustained healing journey. So they could come into our recuperative care program and they could not be as stable. Like Nettie said, they could be struggling with mental health, substance use. We won't turn them away. And if anything, it will want to work with them harder because that is a time for us to show up for them. So, and that is with our clinical excellence, such as the medical staff. We do work a lot with our community partners, ensuring that we're connecting them to the correct resources, but also the data is what really drives us because then we're able to really show the impact that we are doing within the community.
Thank you, Shelby. Now we're going to bring on Ashley to actually describe for you guys how you can communicate to us that you have a referral, so that we can get the process going to get people admitted into the Wellness Center. And I saw a question in the chat about, is it available for patients residing in Redlands or San Bernardino or High Desert only? So this particular service is available for anyone across San Bernardino and Riverside counties. So this process we're outlining to you, these referrals can be made from anywhere within IEHP's service level. So I'll turn it over to Ashley, who will take probably the last 10 minutes or so of our time before we do Q&A to go over the referral process.
Thank you, Dr. Smith. So in order to send a referral, we have a centralized inbox that is recoup@symbacenter.org. This inbox is monitored by Shelby and myself to coordinate services with your team. We do have an internal referral form that we can send out and can be shared with you. Your organization can use that form in order to let our team know exactly what the patient needs, and we make sure that it's a streamlined process. Once we receive that referral form in our inbox, we will let you know that we have received the referral, but we do ask that you send the formal referral to the managed care plan as well. Each managed care plan has their own process. For IEHP, you can send it through the provider portal and or the fax method. So that's the two ways that you can send that to them. And when we receive that, we will then submit our documentation to the provider who will be reviewing your documents for clinical review, just making sure that the patient is suitable for recuperative care, making sure that everything is okay. While the provider is reviewing that documentation, our team is running a background verification. My coworkers kind of touched on it a little bit earlier. The only people who would be ineligible, dependent on that background verification, would be any individual with an active felony warrant or 290 status. We do work very closely with the city of Victorville to try to make any exceptions possible, especially for people who need recuperative care. But we are doing that as a process of the intake verification. A few key elements for eligibility for the recuperative care program. First and foremost, of course, the member must be homeless by HUD definition. We do accept 3 insurances, but we are most familiar with IEHP, and those are the referrals that tend to be accepted a little bit quicker. So we work with IEHP, Kaiser, and Molina. And pregnant individuals up to 12 months postpartum are eligible for recuperative care. But of course, this is subject to the managed care plan's judgment. They have the final say so. So with that being said, members with additional health needs will have a higher chance of approval. And that last step in determination, once our team has reviewed all the documents, we've touched base with the managed care plan, let them know that we are accepting the patient. We will communicate the formal acceptance or denial of the patient to your team through that inbox. And again, just another huge note, because this really facilitates things on our end to be sure that we safely get your patient into the recuperative care program. We do ask that we have that authorization from the managed care plan prior to initiating the discharge coordination. And when that time comes, Shelby does a wonderful job at coordinating that directly with the social worker or the case manager that we've been in contact with to ensure that everyone's on the same page. We will double check that the patient has everything set up, every necessary resource that they may need before their discharge. And then Shelby assists in coordinating that transportation to our facility to welcome the patient. We did want to highlight a few features that we've highlighted throughout the presentation. Number one question that we always get is, do we accept presumptive authorizations? We do accept presumptive for patients who are coming from inpatient settings with documentation, and this is only for those with IHP insurance. Additionally, we also provide short-term post-hospitalization. We have enhanced care management, and we have the housing trio, which is comprised of housing transition navigation services, housing tenancy, and housing deposits. And we also have mental health services available on site. And lastly, we are a pet-friendly campus. We do allow patients to bring their pets, but this is subject to availability, and the pet does need to be present during that initial intake with the patient.
Thank you so much, Ashley. All right, I'm going to take it from here and just kind of reiterate some of the quality outcomes that I know Nettie has already shared and some others. So the point in time count is the major one that really the city focuses on in terms of reducing the number of homeless in the community, and that's been a really strong trend downwards. Even with the new point in time count coming out in 2026, we think that these numbers will be further reduced. We've housed, I believe, as of today, we're at 230. We had one more person housed since the development of this presentation. And really the data that I think is really helpful for those of you who are in healthcare or who are with hospitals or managed care plans, anyone on the call, is that we've done some data analytics of our services, and we found that we've been able to reduce the total inpatient days for our patients by an average of 4.5 days, which means that patients who are coming into our facility, basically from the time before they were in our facility to the time they're enrolled in the recuperative care program, they're staying in the hospital much shorter. And this is partly because of the services we're providing. And if they do get admitted while we're providing services, they're usually not as severe because of the services we're providing, but also because of the discharge planning process. The work that Shelby is doing to communicate with the discharge planners and the case managers at the hospitals allows them to discharge the patient much sooner than would otherwise. And what we found is that this is leading to significant healthcare cost savings, which is really important for those of you who are in hospital administration or may work for the health plan. So just wanted to share some of that data for those of you who may be here. But really quick to kind of end our presentation and give an opportunity for you guys to do Q&A. We just kind of wanted to share a patient story. This isn't a postpartum or pregnant mother, but just a story that really kind of rings true to the typical patient that we see in our campus. And so what we see in this patient is they have a significant substance use, and that substance use has caused them to have a heart condition where their heart failure is very severe, where their ejection fraction is only 10%. They also have co-occurring, psychiatric disorders. And so this patient was admitted to Symba's recuperative care following hospitalization. And a couple months later, after being discharged from our campus, the patient's cardiac function increased significantly from 10% to 40%. And so what we see here is a story of like, many, where A lot of the patients who come into our facility are really ill and they have significant challenges, and we're able to help them with their health needs. And one of the things that we mentioned here on the call today is that housing is considered to be healthcare. We know that people who are living out on the street, their life expectancy is significantly reduced compared to the average American. And so, really getting people into housing, getting them services, all the services we mentioned, really helps to improve not only quality of life, but also longevity of life. And when patients do graduate from our campus, we have them ring this bell, and it says, I'm not defined by my past, I'm driven by my future. And they get to ring the bell and they get to erase the previous number that was listed there, and they get to add one more number to the number housed. And these are just some pictures of our care teams with some of our discharged, successfully discharged patients who have had tremendous success stories, and they get to take these pictures with them and remember all the people that served them along the way as they integrate back into the community. So we thank you guys for your time. We have about 10 minutes for a Q&A, and we welcome any questions that you guys have at this time regarding our services, regarding the referral processes for postpartum and pregnant mothers. We have some time to answer your questions, and we'd be happy to connect with you all to learn how we can better support your organizations serving this particular population in need who may not have a place to stay. Thank you all for your time.
Maybe as people are thinking of their questions, I can ask one. Um, a lot of the questions that I had as you were going through the presentation, they were answered, so thank you. But one question that I do have about the referral process is how long does it usually take from start to finish? Say an organization has a patient that they feel might benefit from this service. Once they submit those referral forms, like what's the timing that they should expect to hear back and kind of move through the process of getting their person on campus?
Yeah, Ashley, do you want to take that one?
Yeah, it's always such a hard question to answer because there's so many moving parts. It would depend if it was like a presumptive authorization where they're coming from an inpatient setting and say it's the date of discharge and you're trying to make sure that they go to a safe place. Shelby and I have been able to get that done same day, right? But when other factors come into play, such as the managed care plan isn't responding quick enough with that authorization, it may take us a little bit longer. So that's why that communication is so important. Even early on in the stay, if you have a patient and you know they're going to be discharged in 3 to 5 days, starting that communication with us will make the referral process so much quicker because we're prepared for the patient to come in and we are on the phone calling the managed care plan just as much as your team is.
Thank you. Sean, I do see another question in the chat if you want to. Um,
Yeah, that's a great question. Thank you, Christine. So our organization is built on the principles and pillars of faith, but our services do not discriminate anyone based on their beliefs. All of our contracts are city and government contracts, and so we would be completely ineligible for those services or provide those services if we were mandating a particular belief or requiring someone to do certain religious practices in order to get services. So I hope that answers your question. We serve people of all walks of life. That's a good question, one that we often get asked.
Dr. Wendy.
Hi, thank you so much. I just love Symba. Anytime I get a little say, we have a couple space open for, moms. It's like, yay. So my question to you guys is, I love that what you guys do, but what are some of the barriers that you see in terms of getting the clients enroll and exiting and finding a permanent housing, so to speak. So, and is there any
Yeah, I
barrier?
can. Yeah, there's a lot of barriers, and that's why we're here trying to break them down. There's barriers for just knowledge and of who we are and what we do and the availability of beds that we have. We do our best to send out, I don't know, actually 100 and some. Well, we're sending over 100 people emails every day, letting people know of our bed availability. So we can get maybe a list from Iana after this and add some of you to that as well. So we're trying to remind people of our bed availability every day. I think there is, as Ashley highlighted, there are some challenges in the approval process, right? And the approval process, we hope, to really uh, advocate for each patient that we have paperwork for and really describe the high level of clinical need, why they need the service. But sometimes those are barriers on definitions of high risk and high need, and so the approvals don't always happen. And when patients are in the facility, as Nettie alluded to, it's low barrier. So there are people that are still using substances off campus, and they come in and they're still under the influence, and that creates challenges. And those are barriers for services for people getting well. Um, but other challenges are, as you mentioned, affordable housing. Some ways that we've been able to support that is through the city of Victorville and the county and the state. We receive rental assistance dollars and rapid rehousing funding. And that funding allows us to subsidize people, especially people who maybe they have a job and they're on the right path. They just need, that first and last month's rent in a few months subsidized. And so we do that subsidizing, and then we also continue to do what we call housing tenancy, which we didn't talk much about today, but we go and then we actually visit the home of the place where the client is currently staying, make sure the landlord is happy, make sure the client is continuing on their housing plan, working through their budgets and their finances. And so really we're focusing on ensuring that no one falls through the cracks. And the major barrier to that is resources. If you give me enough resources, we can cover all the cracks. I'm very confident in our expertise and the team that we have to do that. But finances are always limited. And so it becomes about how do we allocate those resources to serve as many people as we can. So that's our ongoing challenge every day.
Awesome. I'm gonna get your contact through Ayanna because there's a lot of possibility to partner with different, funding entities. So
Yeah, that would be great. Thank you. Great questions, guys. I really appreciate all the questions so far. Any others? Yeah, good question. Yeah, a couple of things popped in here since I looked. Mentioned, oh yeah, we've got, okay, 98% capacity. If you are full at the time of referral, is there a wait list? Yes, there is a wait list. If in this situation, where usually especially for people who are going to give birth and are going to get discharged, the planning there is much easier because the foresight is there, and so we can reserve beds and hold them because we know that's coming in advance. So we don't see that particular issue with this population for this kind of presentation, but we have had to do that in the past for other services. Thank you, Dawn. Dawn's been a strong partner with us for a long time. Brenda asked, how can we get on the bed availability list? I think Ayana is going to send us everyone's contact, and we'll make sure that Ashley includes you guys on the list that we send out every day, 5 days a week. We're sending out emails about our bed availability, so we can do that for you guys. And then last question I see here, what percentage of clients are currently perinatal? Shelby, do you want to comment on that? I think we may have had a few, so very low percentage, right, Shelby?
Yeah. I would say currently at the Wellness Center, we probably have two mothers, and one actually just gave birth a couple of weeks ago, and she transitioned into the family unit. So that was best case scenario because we were able to properly plan, and it was a better outcome for the mom.
And I see we
Hi.
have one question, a hand raised.
Yeah.
Oh yeah, that's me. Hi everybody, my name is Akasi. Hi Nettie. This is so cool to be a part of this because Nettie was the one to sort of inform me about the Symba Center, period, and all the work. So just to hear what's happening with this wellness center is amazing. I had a question. I think Nettie was the one to mention it. As far as community members who want to like just be in support of the wellness center and where it's going, and I know it was mentioned that there might be a phase or beginning initiation phase in the cities of Ontario and possibly Fontana? How can community members be able to show support, like within their particular cities? Or, you know, if we want to help, like me, I'm in the city of Montclair. I want people to know about the Symba Center and the Wellness Center and all the work and want to make sure that it's supported and also, you know, wherever it's headed, that city can get on board. What can we do?
Yeah, Nettie, you want to take that one?
Yeah, sure. So, anybody and everybody on here, because we are providing services to our community and our unsheltered community, the first thing is I would advise, and it's a great thing, to join our continuum of care with the San Bernardino County of Office of Homeless Services. It's free. It is no cost, and we need everybody's voices, and that is how we get the support. Because through those monthly meetings that we have in each region, so like you mentioned, you're in Montclair, that is what we call West Valley. They have their own meetings, and they actually have the strongest regional support out there by the way of Mr. Don Smith, who is a wonderful homeless advocate, not only for the West Valley, but for all of San Bernardino. And that is how the word gets out, really, spreading, that we are all meeting in one place, that we are all speaking the same language, and that we're advocating for more funds to come into our community. Since joining this community, about 5 or 6 years ago, because I was always in Riverside County. I've seen an uptick in people wanting to do more in our own county, with organizations such as Symba coming on board and other organizations, and even just meeting you guys. It takes a village to do this work, and a village means that we have to use our voices. So one way of doing that is joining our continuum of care. What I can do is I can send to Ayana the application for all of you guys to join. We have those county meetings. The usually is the fourth Wednesday of the month. Actually, this month we're meeting actually this Wednesday because we have a priority that we need to get taken care of. And then once you join, your name is added to a list, and you will get every single email from our Office of Homeless Services telling you what is going on, offering trainings, being very transparent about the funding that is available and the issues that are going on. Um, so that is how you can get involved with not only supporting organizations like Symba, but supporting all of our organizations that's fighting the good fight on unsheltered individuals and families.
Nettie, thank you so much. Um, Sean, thank you. Shelby, Ashley, we so appreciate you coming on and giving this presentation. I see a couple emails in the chat. Nettie, when you send that to me, I will send it out with our kind of recap from this webinar. I will make sure we send that out to everyone so they can apply to be a part of the continuum of care meetings. And then we will also share everyone's email so they can continue, or an application for everyone to sign up for that listserv to know about the beds. We are a little bit over time, 3 minutes over, so I want to be mindful and respectful of everybody's time. But if you have any other questions, please, please, please feel free to send them our way. We can pass them along. And then when you get the email from us after this recap, you can reach out to Symba Center with those questions as well. Thank you, everybody, for joining us today.